Hello, SYNGAP Land. My name is Michael Graglia. This is Friday, September 29th, episode 117 of SYNGAP 10, your 10-minute weekly briefing on everything you need to know about SYNGAP 1. I'm going to move as fast as I can. Number one, I like to start with calls to action, things you can do right now at your computer to move the ball down the field. Plan on Rare on the Hill in February of 2024. Plan on it right now. Why would you plan on it right now? Because they just released signups and they just released the application for support. If you don't know what I'm talking about, go back and listen to episode 96. Links in the show notes to the YouTube. Go watch it. Rare on the Hill is an amazing week. It starts with a briefing. It starts with a movie screening, and then there's a briefing on all the policy matters that we as Rare parents should care about. Then there's a day on the Hill where they do all the work. You just show up, you go where you're told, you talk to senators, you talk to congresspeople or their staff, and you explain why they should care about these legislative priorities for rare disease. It gets better. Then there's an NIH day for rare disease. Then there's the FDA day for rare disease. It's all in 1 week. Everybody, you should go. If you're in DC, just block that week out now. If you're like, oh, I'd love to go, but I can't afford to fly, good news. The Every Life Foundation has scholarships for people in every single state. So anywhere you are in America, if you want to go to this thing, links in the show notes, apply today for financial support. Maybe you'll get a ticket. That support is allocated by state. So if you're in like Wyoming, hi, Mickey Anderson, or whoever, wherever, just apply and hopefully you would get a free ticket to DC and you can come and advocate. I'll tell you right now, we have the science to help our kids. We're working on the biomarkers. We're working on the data. The thing that scares me the most, the thing that's going to take the longest to get drugs into our kids at this point is the FDA and regulatory approval. So we need to get every single family on the Hill, out there, talking to people. We have to make the FDA and the legislators understand that our kids are sick, they could be better, and we need better regulatory pathways, less ambiguity, more cooperation in order to get these drugs into kids. So Rare on the Hill, plan on it, apply for a scholarship, do it now. That's number one. Number two, there's a survey from a genetic counselor, wonderful genetic counselor named Abby, who's doing a survey and is going to write a paper about getting genetic diagnoses and what it was like. So if you've gotten a genetic diagnosis, which I assume you have because you're listening to this podcast, go ahead and take that survey. And when it says indication, say SYNGAP 1. Why? Because that puts SYNGAP 1 in another paper. It helps more people understand how to support our families. Important stuff. All right. Those are the calls to action. Let's keep going. There's a lot going on. This week I saw 3 great papers that are all pretty new. One of them came out 2 days ago, a couple of them recently, but they're all good stuff. I want to congratulate people. Gastrointestinal dysfunction and genetically defined neurodevelopmental disorders. Said differently, why do our kids have so much trouble pooping? So Julia Dahlman, Yuichi Araki, great work on that. Context-dependent hyperactivity in SYNGAP 1A and SYNGAP 1B zebra-efficient autism models. Also Dr. Dahlman, very good work. Sensor motor integration supporting perception requires SYNGAP 1 expression in the cortex. In English, Dr. Rumba's team put this one out. This is about helping to understand intellectual disability and cognition in our kids. These is all very important papers. If you go to PubMed and you look at all the published papers on SYNGAP 1, there's 248 to date. And some of them don't include things that have been accepted but not published yet. So that's a number I watch closely. And these are all great contributions to the science. So thanks, guys. That's the science. That's the research. Let's talk about the clinical, what goes on in the clinic, what our patients show up like, what the doctors are talking about. We have webinars all the time, and I'm always amazed that we only have 10 to 20 families there instead of 1 to 200. Guys, these are incredible opportunities for you to ask questions directly to the researchers. But you will be particularly sad you missed this one we just had yesterday. Dr. Andy Stanfield from University of Edinburgh. He's a doctor. He's an MD and a PhD. And sometimes these MD PhDs, they should have stopped at the PhD. I'm just going to say it. But Dr. Stanfield, I'm glad he's got both. This guy is exceptional. And this webinar was off the charts. Families were just texting me. They're like, this is so good. So make sure you watch this webinar. It's already up on our website because we're that good. And it's also on Facebook where we live stream it. Watch this webinar. Watch every minute of it. The Q&A is good. Dr. Stanfield has so many observations, and I think this is one you would probably want to share with your behaviorist, your pediatrician, your neurologist. There's a lot of really, really good insights into the SYNGAP patient in this webinar. And I want to thank Dr. Stanfield for doing it. And I want to encourage every family to please come to these things live. Speaking of which, our next one is Dr. Brian Dickinson. talking about oligos that target translation to restore SYNGAP. Now we've gone back from the clinic over to the science, but oligos are another way to say antisense oligonucleotides, which is one of the therapies most likely to go into our kids. Here's the thing, guys. Right now, it's like Mike waving his hands. Oh, it's going to be therapies. Yay. In 1 to 2 years, I honestly think you're going to be being asked to sign up for a trial where someone's going to stick a needle in your child's spine with a medicine that will increase SYNGAP expression. And if you're like, whoa, really? Yeah, really. And if you're like, well, what is that going to do? Come to this webinar, right? Start thinking and learning now about these things because they're about to become very, very real in the next, inshallah, 24 months or less. So guys, pay attention, show up, learn. Life's going to get really interesting. In the meantime, we need to reduce our kids' seizure burden as much as possible. And the modified Atkins diet, in my humble opinion, is a great way to do that. The ILAE, which is this very, very big International League Against Epilepsy thing. It sounds like a superhero thing, right? International League Against, but they kind of are superheroes. Anyway, they did a webinar on MAD, Modified Atkins Diet, which is like keto light, which in my opinion, tends to help our kids a lot. It's not just my opinion. Summer has an opinion on it. Go listen to her SYNGAP stories. Anyway, this is a very good interview by a doctor in Norway talking about the modified Atkins diet for epilepsy. If this is something you're thinking about, I encourage you to watch this. More killer content. Elle Sanderson, formerly known as Mickey Sanderson, did a special monthly webinar for our families on Zoom about patient advocacy. And as you know, if you've been paying attention, I've really been recently been struggling with Tony's relationship with his school district too. This is dead on, guys. If you have a child in the public school in America, you've got to watch Mickey's special monthly Zoom meeting, which we should probably have done as a webinar. But there's some really great discussion in there. Mickey's just throwing out the facts. We are lucky to have her in our community, and I encourage you to watch that. I also want to remind you that if you know anyone who loves a Syngapian or knows a Syngapian and speaks Spanish, our Spanish-speaking podcast is growing. Cafe Syngap 1 dropped their second episode just recently with Juanita Polanco, who is the mother of Epsi and, I can't believe I'm forgetting this. Esperanza. No, there's another name because Epsi is Esperanza. SP is Esperanza. Anyway, whatever. Juanita Polanco has twins. One of them is called Esperanza. The other one is escaping me. And it's a really great interview in Spanish, I'm told, because I don't speak Spanish. But anyway, listen to that episode. And then Simon's Searchlight, which does a registry for us, shares data quarterly. They just did a data dump. If you don't know what Simon's is or you're not signed up, sign up for Simon's. Citizen Retrospective, Simon's, and RareX Prospective. They're all good things. Sign up for as many things as you can possibly handle. Upcoming events. Here's where it gets good. Next week, 4th through 6th, Wednesday through Thursday, we're going to do the Cannonball. Cannot wait. Brett, Peter, Monica, and Reese. It's going to be amazing. There's $65,000 in tech giveaways. There'll be a live stream. SynGapResearchFund.org/Cannonball. Check it out. Right after that, on the Saturday, Julie Miles in Traveler's Rest will be doing her Scramble, her golf event to raise money for SYNGAP 1. Thank you, Julie. If you don't know Julie, you should listen to her SYNGAP stories. And then JR and I will be attending the following week the Park City Epilepsy meeting, which SRF is sponsoring. Mike, why are we sponsoring meetings? Well, we're not the only sponsor, but because there'll be a lot of clinicians at this meeting, and I want these people thinking about SYNGAP, right? That's the goal. So JR and I will be going, and I'm really looking forward to seeing some of our grantees and our partners at that meeting. It's going to be amazing. After that, I'm giving a keynote at Enabling Patient Access to Health Data for Actionable Results. Feel free to join if you want. That's in coordination with one of the Centers of Medicare and Medicaid Services. Why am I doing that? Well, because health data really matters, guys. And I've been a vocal advocate, as you know, for Citizen, and I'm honored that the government has asked me to come and talk about it because patient access to medical records really, really, really matters. And I just wanted you guys to know I'm doing that. It's pretty cool. And then October 21st, we're having the third annual Karen Lieb Gala. So we just had the second annual soiree. We're about to have the third annual Cannonball. But the gala was one of the earliest fundraisers that ever happened. Thank you, Nancy Kessler. And if you're in the New York or New Jersey area, make sure you go to the gala. Make sure you have a good time. Meet some other SYNGAP families. These events are amazing. The Mac Daddy of events, the big one is the conference. The conference gets better every day. You have to sign up by Halloween. Guys, you have to sign up by Halloween. There's a lot to do with the conference. We have to do hotel rooms. We have to book meals. By the way, we're going to be inviting you to dinner. Look forward to a link there. You got to get yourself a t-shirt. I'm wearing mine. But the other thing, this just happened this week. We were talking to one of our partners, and I'll announce this when it's a little more firmed up, but there's going to be a chance to participate in like a mini trial during the conference. I'm just going to say that. It's a device trial. So if you are bringing a Syngapian, that's awesome, because we will have a chance to learn from them in real time at the conference. It's just one of so many things that's going to happen. Those days are going to be nuts. So sign up for the conference. Look forward to it. Information's online. Please join us and bring your Syngapian if you can. As usual, guys, I want it all. I want your time. I want your blood. I want your money. I want everything. So sign up for Citizens. Sign up for Simon. Sign up for RX. Come to CHOP. Participate in that natural history study. A mom just called me a week ago. Her kid's having a hard year. And she said, "What's going on at CHOP? Should I really do this?" And I was like, "Oh my gosh, you'd be crazy not to do this. Get over there, especially if your child is having a hard time." So I encourage everyone to take part in CHOP. I encourage everyone to volunteer. I said this last time. And there's just so many things you can do, including giving us 5-star reviews, right? So everywhere you see SYNGAP online, on Facebook, on Google, on Twitter, on podcasts, go ahead and take 5 seconds and just give us a 5-star review and say something nice. Why? Because there's 100 SYNGAP families behind you who are going to get diagnosed. And how are they going to find us? How does the internet work? Reviews and scores and things. So give us good reviews, guys. Help people find us. Help people understand the incredible quality work we're doing here. And that's my phone ringing. So thanks for listening. Have a great week.